Did your insurer deny Wegovy, which contains Semaglutide, or Zepbound, which contains Tirzepatide? Do not appeal until you identify the denial category, because the wrong response can waste your deadline. Missing records may be fixed with one corrected submission, while a benefit exclusion usually cannot. The plan reviews specific contract rules, not whether treatment sounds reasonable in general. Prior authorization is the insurer's checklist before it pays for a drug. The plan compares the request with covered diagnoses, starting weight rules, required records, and preferred medicines. One missing item can trigger denial despite a reasonable prescription. The first fix is finding the exact rule that failed. Start with the written denial notice, not the short pharmacy message. Prior authorization required may mean no review occurred yet. Criteria not met means submitted information failed a rule. Not covered may indicate a drug list restriction, a contract exclusion, or an incorrect claim. Call the insurer or the company that manages its prescription benefits. Request the exact denial reason, written policy, appeal deadline, and required submission method. Ask whether the office should correct the request, seek another review, or file a formal appeal. These routes may use different forms. The insurer's public website may not show the rules for your exact plan. Members of the same insurer can have different employer benefits and drug lists. Use your member portal or the number on your card. Request the policy name, version date, and criteria for your plan. That policy check prevents a second mistake. A pharmacy rejection after approval may involve the dose, refill date, quantity, pharmacy, or claim details. Another appeal may be unnecessary. The pharmacy and prescriber should compare the approval with the rejected claim before changing treatment. Once the claim route is clear, verify the starting measurements. Many plans use body mass index, a number based on weight and height. A starting body mass index of at least 30 often qualifies. Some plans allow at least 27 with a weight-related condition. The record may need height, weight, calculation, diagnosis, and measurement date. The starting value means the measurement before effective weight loss treatment began. Samples, earlier medication, or intensive lifestyle treatment may already have lowered today's weight. Sending only the newer weight can hide the original eligibility. An older dated office note may therefore support the request better than a new summary. The diagnosis must also match the requested product and reason for treatment. Wegovy and Zepbound are weight management medicines, while related brands may be approved for type 2 diabetes. Never add diabetes that the patient does not have. Document obesity and the real weight-related conditions listed in the policy. Plans may also require evidence of lifestyle treatment or earlier medication trials. Useful evidence includes dates, duration, results, side effects, and reasons for stopping. Diet and exercise failed is usually too vague. Describe the structured plan, follow-up visits, weight change, and why a preferred medicine did not fit. A strong letter explaining medical need cannot create a benefit that the contract excludes. Some employer plans exclude weight loss drugs even when every clinical requirement is met. Repeating the same request with stronger language usually produces the same denial. More paperwork does not repair a missing insurance benefit. That is why two identical denial screens can require opposite responses. One patient may gain approval after a corrected starting body mass index. Another may have perfect records, yet the contract excludes weight loss treatment. The first case is mainly documentation. The second is mainly an insurance contract problem. Now classify the denial into 4 groups: missing information, unmet clinical criteria, covered drug restrictions, or a benefit exclusion. The category determines the next action. Sending one generic appeal to every category wastes time. It can also bury the evidence the reviewer needs. For missing information, correct the record and resubmit through the route the plan requests. Include starting height, weight, body mass index, dated diagnoses, prior treatment, and dose. Add test results only when the policy requires them. A complete targeted packet is stronger than a long, unfocused one. For unmet clinical criteria, quote the exact clause that failed. Answer it with dated records rather than broad claims. When the policy requires an earlier drug trial, state the drug, dates, response, and reason it ended. Do not make the reviewer reconstruct the history. For drug list restrictions, identify the preferred alternative and exception rule. Step therapy means trying a plan-preferred drug before the requested one. An exception needs records showing failure, side effects, or a medical reason the preferred option is unsafe. Claims that Zepbound works better do not answer that rule. Coverage restrictions can also depend on the approved use. Wegovy can reduce heart attack, stroke, and heart-related death in adults with obesity and existing heart or blood vessel disease. Zepbound can treat moderate to severe obstructive sleep apnea, repeated breathing pauses during sleep, in adults with obesity. Coverage exists only when the plan includes that use and the patient qualifies. For a benefit exclusion, ask whether the contract offers an exception. When none exists, repeated medical appeals may go nowhere. The practical options may include discussing benefits with the employer, changing plans during enrollment, or comparing self-pay programs. This barrier comes from the contract, not a missing diagnosis. An appealable denial may proceed to another appeal or independent external review. External review means a reviewer outside the insurer examines the decision. It may help when the dispute is whether treatment is medically needed, but it usually cannot override an explicit contract exclusion. Coverage can disappear at renewal because previous approval does not guarantee future approval. A new plan year, employer decision, drug coverage company, or policy version can change the requirements. Compare the old approval with the new denial. Ask whether the plan can keep covering the drug briefly while new rules take effect. Renewal denials require different evidence from first-time requests. Many plans ask for starting weight, current weight, treatment dates, percentage lost, and continued lifestyle work. Some policies require at least 5% weight loss. Without the original weight, successful treatment may look unsupported because progress cannot be measured. Calculate that percentage from the original weight. Subtract the current weight, divide the difference by the original weight, then multiply by 100. Losing 12 pounds from 240 pounds equals 5%. Include both weights and dates so the reviewer can confirm it. Do not wait until the final refill to investigate. Appeals have deadlines, and collecting older records can take time. Request expedited review only when delay could seriously harm health. Expedited means the plan reviews the case faster because waiting creates a documented medical risk. A useful call confirms 5 points: denial reason, exclusion status, current policy, required evidence, and submission route. Ask whether the office should correct the request or appeal it. Record the representative's name, reference number, and deadline. These details help resolve conflicting instructions later. Avoid 4 common mistakes. Do not submit conflicting weights without explaining their dates. Do not claim treatments that never occurred. Do not send a generic letter that ignores the failed rule. Do not switch diagnoses or products unless the prescription, request, and record remain accurate. The strongest appeal is narrow, factual, and matched to the denial. Attach the notice, identify the failed rule, and answer it with dated evidence. Fix missing documentation before the deadline. Recognize exclusions early because repeated clinical arguments cannot rewrite the plan contract. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.